So people are coming up with a lot of symptoms. Okay, like people complain of. Are you able to hear me? Yeah. So people complain of often with the high pollution level. They complain of heaviness in the head. Okay, or people have a mild headache. It's never a sharp, intense headache, but they've got a mild headache. Then there is also burning in the eyes, irritation in the eyes, watering in the eyes, dryness in the eyes. Then people have a lot of nasal symptoms also. People might have running nose or bouts of sneezing or a stuffy nose. People might have an irritation in throat where they constantly want to clear their throat, and it may or may not make them feel better, but that's another thing. Then people land up with cough as well. So then people might have chest congestion, or they might have a lot of shortness of breath. And all those people who suffer with COPD or are asthmatic, then they also suffer with a lot of shortness of breath, wheezing, and all the associated symptoms. Okay, the cough may be productive, may not be productive. In general, this high pollution level is also causing little decline in energy levels. People might feel constipated. So this is also known to affect the blood pressure, disturb the sugar levels, and also affect the heart, among many other effects. Okay, so you know, if you look at people smoking, okay, so so some smokers, when they smoke for a longer period of time, they might develop a persistent sore throat or a cough which is from the throat. Some people might develop uh, a more active lung problem. Some people develop coronary artery disease, or they have clogging of the arteries. Some people develop uh, the cancer of tongue. Some people develop cancer of mouth. Some people develop cancer of throat. Some people develop cancer of food pipe. Some people develop testicular cancer. Women may develop ovarian cancer. So if you see, it's the cause is the same, yeah, but the effects are varied. So this is what we understand in homeopathy as individualization. So we cannot have one remedy for all patients or all different disease presentations, and you cannot expect similar effect from the same trigger. The effects are always subject to their entire biological and psychological framework and profile, and their situations and circumstances, and their own idiosyncrasies, their own susceptibilities. So it's always varied. Okay, now, so for instance, nowadays, when you'll find amongst the cold and everything, what you'll find more prominent is people are having a sore throat or a cough or a constant clearing in throat. Okay, and I'm sure in last 6 weeks you would have seen in your practice that many of them do feel better by having something warm. Okay, you'll find if they are not better by warm, then you have a separate group of remedies. But if they have got a sore throat, which is better by having something warm, so if it is absolutely the beginning, and they have the beginning of a sore throat with intense dryness and their desire to clear it, or have that dry cough, as sir also said, if they are better by having something warm. So they would want to have anything warm for that matter. Okay, so it may be warm food, maybe warm water, maybe anything warm. Okay, then you think of spongy as a remedy. But remember, if they want to have something warm say for instance tea or coffee, for instance, and they want it too sweet, okay, then you will not prescribe spongia or prescribe it extremely cautiously because spongia is generally worse from sweets. Okay, so if they want to have something warm and sweet at the same time, yeah, then the remedy is sabadilla. Yeah, so they will have a warm, hot, sweet milk, or a hot cup of tea with a lot of sugar, or hot cup of coffee with a lot of sugar. But anything which is hot and sweet, then you think of sabadilla. If they are better by, for instance, especially they say, I want to have something like a soup, okay, then the remedy is kilkiri ars. Kilkiri ars, okay. They would specially want that. And there's some people who will tell you, and I've actually seen that in last couple of weeks, that they would want to have something like a very spicy, hot Chinese soup. That's the only thing which makes them better. And then the remedy is lacquinine. Okay. And then if they want to have something warm or hot, but if they have a hot soup, even if it is bland hot soup, it makes the throat symptoms worse, then the remedy is alumina. Okay. So very tiny modalities, and alumina, remember, is one remedy which also has sudden hoarseness coming up. And with that, they would want to clear their throat very often. But it is not better by clearing the throat. Rather, the symptoms may become worse by doing that. Okay, then you think of alumina as a remedy. If, on the other hand, they are better by clearing the throat, then we have many remedies, and then it also becomes a common symptom. Okay, so, but in alumina, remember, there is usually a persisting dryness in the throat, and it is always better by having something warm, whether it is warm food or warm drink of any sorts. But having soup will make it worse. So they may want to have warm water, they may have a warm herbal drink, they may have anything warm or hot. But that. And especially in nowadays weather is when you will find alumina also an important remedy. Okay, so again, you have to understand, are we going to target the bad effects of pollution, or we're going to target people who are reacting to the pollution? What do you think in homeopathy we target? It's your reaction to that pollution, because that's what defines you, and that's what needs to be remedied. Okay, so as Hahnemann writes in his work on chronic diseases, sees it effectus, sees it causa. And you'll find that when you give the right remedy, that susceptibility and that sensitivity will be corrected by your remedy. People will be less susceptible to the same trigger thereafter. Only then you have the right curative remedy. Are we together?
But the patients coming nowadays, they all have same symptoms.
So they have similar symptoms, sir, not same. There'll always be different modalities, sir. Okay, and when you look at them, then you will also find their sensations will also be slightly different. Some people will say ऐसे लगता है गला छिल गया है. Some people will say कि बिल्कुल सूखा खुश्क हो गया है. Some people will say कि अंदर चुभते हैं कांटे. Some people will say कि अंदर जलन होती है. So everybody will give you a different sensation. And remember, the symptoms, आप बिल्कुल सही कह रहे हैं, the symptoms may look same, but they are similar.
Lot of expectorations and all.
Yes. So black expectoration then becomes a common symptom. So remember, our prescription will never be based on the common symptom. Our prescription will always be based on either their peculiar modality or the evolution of symptoms or their peculiar sensation or any other concomitant factor. If we do not find any of these, remember the patient is very difficult to cure, provided that the physician is not in a rush to treat them. Okay, it should not be our fault. But if you are unable to find prescribing symptoms, modalities, sensations, concomitants, either it is our fault that we are not able to discern, or the patient is incurable. So alumina is, I believe, and what I've learned with time, is one of the lesser understood remedies of a Materia Medica. And usually, people will prescribe lachesis, lycopodium, sulfur, merxol, and even different nosodes more commonly in their practice. But people don't use alumina that often in their practice. But I believe that's also majorly because of a lesser understanding of the remedy. Okay, so alumina and causticum, they are very similar remedies. Can you give me any one or two symptoms which are similar between alumina and causticum?
Persistent dryness,
Yes, persistent dryness. Yes,
known as hacking.
yeah.
So
Okay.
slowly progressing.
Yes.
This is the always.
So both the remedies have a gradually progressing effect, and especially which is gradually progressing paralytic effect. So now what happens is, when you, how do you discern it is paralytic? Because the patient will feel devoid of energy. They would not want to make any effort to move. Then another thing where both the remedies are very common, of course they are similar in nature, is the persistent anxiety and apprehension, or chronic anxiety and apprehension, or a tendency for persistent anxiety and apprehension. Both are excellent remedies for that. And uh, what is more particular about alumina is that these patients are quite pessimistic in nature, like Suriname. They will always take things in a bad part. They will always think. So, uh, if you remember, we used to read that example. Some people say half glass is full, some people say half glass is empty. Alumina will go further and say there's really something wrong. It can't be right. So, they take life or situations or circumstances are happening in, they do not even give them a remotest possibility of being positive. And another thing, it also strongly affects their memory and recollection. Okay, it strongly affects, and they're unable to think connectedly. And especially in the provings, they've written that they're unable to think connectedly, and something which has also been strongly highlighted by Pooning Hossain, not by most of the other authorities on the Materia Medica. So for instance, give you an example. There are patients who might come and tell you that they are unable to recall the correct sequence of events. They're unable to connect the dots in their life or in their conversations or their comprehension, their understanding. They will have these areas which will completely be blurred, and they would not even remember what happened there. Okay, so that is one of the important features of alumina. It's also there in the proving. But now, for instance, somebody's got Alzheimer's. Would you think of a remedy like alumina? We may, but not on this symptom. because that is then a common symptom of the disease. It doesn't mean we can't prescribe it, but we can't prescribe it on that symptom. So, for instance, if the same patient or the attendants tell you that their observation that around the new moon or full moon, when their symptoms are worse, then you think of a remedy like alumina. Okay, so especially new moon and full moon. Okay, then it has some very peculiar direction of symptoms. Okay, so for instance, and they are singular to alumina. Like for instance, the pain in the rectum. For instance, they pass hard stool and that is painful. That pain in the rectum will extend to the ankle. This is singular to alumina. You will not find that anywhere else. Okay, pain in the rectum extending up to the ankle. Okay, then uh, so for instance, they have another direction of pain, pain from the right hypochondrium and only right hypochondrium. At the moment they bend forward, it will extend to the epigastrium. Could be a symptom of gastritis, could be a symptom of cholecystitis, could be a symptom of hepatitis, or it may be a symptom of any intestinal infection or anything for that matter. But especially on bending forward, the pain will extend. So some directions of symptoms, they are quite typical. Okay, then it also affects your uh, sensations in very different ways. So alumina is another remedy which has a sensation as if growing large, as if growing larger in directions, or as if the body is becoming numb. Okay, or as if the body has, or some part has become unnaturally smooth. And that's also a very singular symptom that you'll find in alumina. There's sensation as if some part has become absolutely smooth, which is a sensation that they experience. It may not be that way, but they suddenly feel that way. Okay, then while it has pessimism, it has um anxiety, apprehension, despondency, features of depression, which are worse in the morning hours. It has produced all of that. It also has produced the exact opposite state, which is being mild and cheerful. Okay, so again, it's a biphasic action that you will observe in alumina as well. Okay, so Aditi, how do we move this picture? Yeah. So, can you tell me any,
Rubber hटा
yeah, generality of alumina? Any generality besides what we've just discussed? So, for instance, it is considered the aconite of chronic diseases. Okay, it's considered to be aconite. So, uh, as we've discussed earlier, also, just like aconite is synonymous with any acute condition, alumina is synonymous with chronicity. So, usually the patients of alumina tend to go towards chronicity unless and until alumina is prescribed. So, for instance, they will usually have a lot of residual symptoms after the acute disease is gone. So there'll be a persisting weakness, for instance, or you'll find that often the fever has gone away, but now the cough irritating is persisting, and with that, they the only thing which makes them better is that they feel better by having something warm. That's the only thing. So, for instance, so they tend towards chronicity. What other generality do we know?
So what's in winter?
Yes, it's a chilly remedy. Okay?
Dryness.
Yeah. Dryness, yes. Slowness, yes. And, sorry?
Eating.
Okay. What else? Sorry.
Sir, eating, desire to eat, but it gives relief to the symptoms. Eating and urine.
Yeah. Yes, in some aspects, they are also better by eating,
Eating.
especially something warm.
And
Yeah.
potatoes disagree.
Potatoes disagree. That's a very important symptom. Yes. And it's quite singular to alumina only that potatoes disagree. Okay.
Cough that is aggravated by irritating things like
Yes, irritating things produce cough. So, for instance, if they will have pepper, that will bring out cough. Or if they have anything which is a little dry in texture, that will trigger and produce cough. At the same time, they may also have craving for
Indigestible.
indigestible things. Okay, so that's always indicative of anemia. In most of the cases, it is indicative of pneumonia. So, whenever you find there's somebody who will come and tell you, I crave chalk or dust,
Calcium deficiency.
uh, majorly iron deficiency, man, majorly iron deficiency. Or, they crave for ice, they want to chew ice. You should always check their iron levels and their hemoglobin levels. Okay, if that is normal, then you can consider that a symptom, not otherwise. Okay. um, I remember many years back, so very early in my practice, I remember there's a lady who came, and she had uh, a persisting fissure, and she said, she had a very strong craving for ice. She said, throughout winters also, I want to crunch ice. I have that strong a craving. She preferred sleeping on the belly. I remember I gave her Medorinum. It had zero result. Okay. And then once after a couple of weeks of follow up is when she came back and she said, I don't crave ice anymore. I said, how is that possible? And I thought probably Medorinum has removed that symptom, but the other symptom is spraying. And then she said, I went to my family physician and he ran some blood tests and found my iron levels are very low. I took iron and that symptom disappeared. So that's something which I learned at that point of time. And I believe a lot of times we all learn from our mistakes. So that's when I eliminated that particular symptom and I prescribed on the other symptoms and she became all right. So that's something I have learned with time. I think that's where most of us lack also. We are not given that kind of clinical exposure in our colleges. So a lot of things we could have learned better. Okay. Have you filled up that survey, please? Ma'am, you have, please? भर दो यार, प्लीज भर दो, प्लीज. वरुण ने भी नहीं भरा है. मैं जानता हूँ, जस्ट बोलेगी लाइक. अनुभव, आपने भरा है? वेरी गुड. आपने तो भरा ही है. सर, आप भी भर देना प्लीज. हाँ, प्लीज भर देना. वरुण, एक बार दोबारा फॉरवर्ड कर देना जस्ट. एंड प्लीज गाइस फिल इट अप, बिकॉज एक हमारे लिए बड़ा यूजफुल चीज है. और अभी 31st को हम वो सर्वे क्लोज कर देंगे. काफी सारी कंट्रीज से हमारे पास रिस्पॉन्स आ गया. सो एनीवे, so any other symptom as a generality you can think of, alumina? Yes, that's another sensation. They have time passes too slowly. There's persistent anxiety and apprehension, and they feel the time is passing too slowly.
Fainting at the sight
Yes.
of blood.
Yes, both the symptoms. They very soft stool also requires
Lot of
great straining, and whenever there is hard stool, Whenever there is hard stool, so whenever there is hard stool, then it is invariably painful. They still have to exert a lot, but that hard stool is also very, very painful. Okay. Soft stool requires training, but hard,
Ignition.
sorry,
Ignition.
not small.
maybe,
CPR.
maybe,
Contradictory method.
yeah, yeah. But in provings, we have generally found this symptom in alumina. The other thing is, alumina patient also passes the stool better standing. Okay, like causticum. Okay. Uh, any other symptom? And ma'am, what she rightly pointed out, faints at the sight of blood, and uh, the only thing, ma'am, what I've seen is sometimes that is a drama to gather attention. Sometimes you'll find the patients just create a drama to get attention, and then they may pretend as if they might faint. But if we just are able to discern whether it is a genuine symptom, it's a symptom worth its weight in gold and singular to alumina. Any other remedy? Any other generality that you can think of? Yes, okay. Dysphagia.
Lead poisoning symptoms of can be
Antidoted.
antidote.
Yes, okay. What else?
Chronic itching
And
due to dryness of the skin.
Yes, and especially in winters. Especially itching coming on in winters and being worse by the warmth of bed.
that.
Okay. And
Temporary eruptions.
yes, yeah,
Granular lids like graphites.
yes, yes. And then it has extremely sharp pains, and pains as if a hot iron rod is thrust inside. Okay. Usually they say it is in the lower part of spine, but it can also be found, for instance, in the limbs, as if hot irons.
इसी सेंसेशन का पेशेंट ने मुझे यही लैंग्वेज बोली आके
जी.
कि ऐसा लगता है किसी ने हॉट आयरन रॉड में
Yes.
स्पाइन में डाल दी है.
Yes. So that then is alumina. If it is hot needles, then we think of arsenic. Cold needles, then we think of agaricus muscarius. Okay. Then
So liturgia is another
very important general feature. It is usually acrid and extremely exhausting. So alumina patients are generally profoundly exhausted. So before or after periods, they'll be exhausted. With discharges, they'll be exhausted. After fevers, they'll be exhausted. During fevers, they'll be exhausted. It's a common symptom that you'll find exhaustion. So much so that they have complete disinclination towards movement. Completely, because they're devoid of energy. It's too tiring for them to move around. Any other generality you can think of in alumina? Any other generality?
Medicines for there is evidence Parkinson's.
So it is one of the remedies
one of
where
the symptom cannot pass urine until he strain for the
strain. Yes, yes. That's another symptom. Very important symptom.
The violent itching of inner canthal.
Okay, मतलब more a particular symptom, not really a generality. Any other thing you can think of? Then generally alumina patients don't perspire much. They don't perspire much. Okay. So so though it is a chilly remedy, but it is also a little better by movement in the open air. Generally, they are better by motion in the open air. when the weather is pleasant. It should not be too cold, of course. Then
The constipation in children, especially those they are
bottle fed.
Bottle fed.
Bottle fed.
and the powdered milk.
Yeah, bottle fed, powdered milk,
Powdered milk
or even artificial foods,
foods.
they aggravate.
Powdered milk.
So I remember
But I
this.
have used this medicine very successfully to manage the cases in neurological problems.
Yeah.
Slowly developing neurological problems.
Yes.
Gives very good relief.
Yes. And ma'am, another thing, it's one of the few remedies which has produced festination in the provings. Okay?
Frustration.
The mean,
Festination. So,
Healing.
no. Festination.
More involuntary movements होते because of the lower motor neuron dysfunction.
Okay. And the other thing is, it also produces. So, do you remember reading something called festinating gait? Yes. Yeah, so it's more a symptom of Parkinsonism. Yeah. So it's produced that festination, that festinating gait. And it has another symptom that if their eyes are closed, they cannot maintain a balance. Again, it's a symptom of neurological, it's a common symptom of neurological disease. But again, you cannot prescribe Alumina on these symptoms. There have to be other symptoms which will govern your prescription.
I have prescribed this medicine in a case of ataxia, where the lady was having very slurring speech. We could not hear her words properly and difficulty in walking. The husband brought her in the clinic. When I took the case, though she was diabetic as well, then she complained of severe constipation and lot of irritation, especially in evening. Though she maintained a very balanced diet because doctor told not to gain weight, you will be suffering later if you will gain weight. So you should maintain your light diet. I on these basis, and the one symptom is that I hardly perspire. These are the symptoms: constipation and lot of irritation in evening, loud, and from years together. You will not believe, in 3 weeks of treatment, her speech became so clear and constipation improved, though she is still under treatment. But this was the
Awesome.
symptom which one can see in clinic. Even her husband
Awesome.
was shocked
Awesome.
that we have been taking treatment from 3 years, but not much response, though she is deteriorating.
Awesome.
So this is
So that's the power of Alumina. That's the
lot of
therapeutic
irritation.
potential
When I
of
advertised
Alumina.
the case, Alumina came on top in evening especially. Not me.
And this is where this remedy is also very similar to Argentum nitricum. Okay, they also have, both the remedies have a lot of irritations. Both the remedies are emaciating with anxiety and apprehension. But the difference is,
Craving for sweets is there in adult.
Alumina is slow adrenaline.
Yeah, it is slowly
so for
progressive.
both of them, the time passes too slowly for both of them. But what happens is, this is a chilly remedy and that's a hot remedy. It'll crave lot of cold air, fresh air. This would want a little open air, but definitely not cold. And
But in Argentum nitricum, the history of anxiety is there in a case if we go in detail. But in Alumina, I have seen disappointments, grief.
ma'am, it is also one of the remedies, strong remedies for chronic anxiety and apprehension.
Alumina.
Yes, very strong remedy for chronic anxiety and apprehension. When you read the Materia Medica, you'll find many symptoms of anxiety and apprehension. And that's what is also highlighted by most of the authorities on Materia Medica. Okay. So that's why they are quite similar. Then their neurological symptoms, because both Argentum nitricum and Alumina have produced lots of neurological symptoms in their proving. Lots of them.
Time passes slowly in this in Argentum nitricum.
Both of them. Both of them. Yeah. Okay, guys. Take care. And then I will see you guys next year. We'll continue studying alumina. Okay. Thank you.
Happy New Year, sir.